Good day, and welcome to the April 2023 monthly video update for the Montgomery County, Pennsylvania Office of Veteran Affairs. I'm going to warn you in advance, it's going to be a long video. It's going to be an educational video, and it's going to be a talking head video, so there's just going to be me passing a lot of information that's going to show up on your screen. I like to have videos that are shorter and more entertaining, but we're getting too many calls about the current situation, and I want to just be educational or didactic in what I'm trying to tell everybody. This way I could refer people when they call us to say, look at our April video, and then you'll have a better, clearer understanding of what's going on. The most common time-sensitive question that we are asked is always, can the VA take care of my aging parents? I'll say that again. Can the VA take care of my aging parents? And the answer is, unfortunately, maybe, and never as much as you completely need, but what they help you with is going to help you out a little bit. So I just want to let you know. Nothing in this video can replace meeting with a veteran service officer because every situation is different. But I need you to watch this video so you know what's out there, what programs are there. The other thing is that we are not the federal government. We are the County Office of Veteran Affairs. We've been around about 100 years, and we work for the Montgomery County Commissioners. We are an accredited VA affiliate. And we are also, luckily, a huge part of the Montgomery County Department of Health and Human Services. So we are uniquely poised to refer you to other programs. And as always, there is no charge for our services. History lesson. About 158 years ago, during Abraham Lincoln's second inaugural address, he said that he wants the government to care for him who shall have borne the battle and for his widow and his orphan, which is the VA's motto today. It's a little dated because it just talks about him when we have plenty of women veterans that we should be proud of that need support, but still, to care for him who shall have borne the battle and for his widow and his orphan. And everything that the federal VA does, luckily, seems to stem from that statement from 158 years ago. Now, a little bit of a review. There are three parts to the VA: the Veterans Benefits Administration, the Veterans Health Administration, and the National Cemetery Administration. Actually, I lie. There's a fourth part, and it's the Vet Center. The Vet Center does unique, out-of-the-box thinking type of counseling for certain veterans, 1-877 War Vets. But they're separate and a little bit small. But the Veterans Benefits Administration, VBA, and Veterans Health Administration, VHA, are what we're going to talk about here, and they have complementary programs. But first, to set the stage, because we're talking about aging parents, let's talk about aging concerns in general and what situations make a concern where people usually call us. And I'll just group them: fall risk, mobility, incontinence, and I'll just say the last one is mental issues, dementia, sundowner syndrome, or just regular cognitive degeneration. I also want to be clear, those are the aging concerns. I want to be clear that the mutually accepted goal that we have here is to ensure that people can safely age at home for as long as they can. So just that's our stance as it is right now. The best advice that we have is to make a plan early on with your parents and your siblings or your other relatives or your neighbors, which is uncomfortable as heck because your parents don't want a caregiver. And they, at least of all, they don't want to inconvenience their children. And their children don't want to be intergenerational caregivers either, meaning that they take care of their parents and they take care of their kids. But oftentimes, that's what happens. Oftentimes what always happens, most of the time what happens, I'm generalizing too much, but very often someone will have 7 kids. It's always that one kid that ends up taking the brunt of everything. So people that call us, most of the calls that we have that ask the question, will the VA take care of my aging parents, are in December through March. Because people see their parents during the holiday season, and they see that their parents may be, or parent may be food insecure, which we saw a lot of this winter, or that they have the aforementioned fall risk, mobility, incontinence, mental issues, and they need help and they need it immediately. The problem is there is no immediate help in most cases. The available resources have been quickly overcome by community needs. Also, the resources are not timely nor comprehensive. Now, I'm not trying to make an apology for this, but I'm just trying to tell you how it is. And knowing how it is will set the stage for a strategy to maybe overcome those barriers. The resources are not timely or comprehensive, and there may be a period when the caregiver, children, or relatives or neighbors and the person needing care don't have any help until you can get that support in place. Let's talk about eligibility. Eligibility for most programs centers on length and time of service as well as income. Veterans with wartime service, even if they didn't fight in the war personally but served during that time, even if they just served one day during that time, makes them eligible for a lot more programs than those without. If they served during wartime, we call them wartime veterans. If they served during peacetime, they're peacetime veterans. For example, those who served between Korea and Vietnam are peacetime veterans. They're also known as tweeners because they served between the wars. And if they served between Vietnam and Desert Storm, we call them Cold War veterans. Check out our website for specifics on what those periods are. But because the VA intends to help the neediest of veterans first, and well, money solves many problems, income is also a definite factor. And it's never straightforward, which is why you need a VSO. Seems a little out of tune. Where did that banjo come from? Magic. So we're going to talk about programs. That was just a little break because this is going to be a long video, like I said. Programs. I'm going to start with the Veterans Health Administration before we talk about Veterans Benefits Administration. And the reason is that VHA and VBA, like I said, have complementary programs, and the VHA programs, in my opinion, are incredibly innovative, and they're newer programs. The first one for what can the VA do to help my aging parents is VA healthcare. If you want to use any of the VHA programs I'm talking about, they need to be enrolled in VA healthcare. They can enroll over the phone by calling the National VHA enrollment number, which I think is in Dallas, at 877-222-8387. If you want to keep it a bit more local, you could call the VA in Coatesville at 610-383-0239 and ask for the Enrollment and Eligibility Office. If you want to make it even more local and up close and personal, you can go to the West Norriton Clinic that has an eligibility specialist on Mondays and Tuesdays, and you don't need an appointment. But the veteran must be present. The questions that they're going to ask you have to do with your current health insurance and your income. Please understand that for VA healthcare, there are 9 levels of eligibility. And they're based on things like, were you a prisoner of war? Are you service connected? What is your overall rating? That's the top tier ones. Then it asks you about income, and then whether or not a person is catastrophically disabled. And I need you to remember that term. We're going to come back to it. But every eligible veteran will fall into one of these categories. But I want to talk to you about the income categories, and what catastrophic is. And I want you to realize this is just me letting you know what the landscape is. I'm not an enrollment specialist, but I want you to talk to an enrollment specialist, and I want you to say certain key words. When you enroll, they're going to ask you about service. We covered that. Household income and your present insurance. They're going to ask you about your present insurance because VA healthcare exists alongside any civilian providers you have. You don't have to give up your primary care, your parents' primary care physician or your primary care physician if you're the veteran inquiring. You don't have to give them up. But at the same time, they want to see what coverage you have as opposed to what coverage you're eligible for. About specific service, I'm not going to touch on that. We talked about it a little bit before about wartime, but I'm going to leave that to the enrollment specialists. Peacetime veterans are eligible for VHA healthcare. Next thing they're going to ask you is about household income. and it has to do with what the veteran and their spouse, if applicable, earns in a year. But it's offset by your current medical costs, out-of-pocket medical expenses. So you need to bring that with you for your parents or if you're the veteran applying. And that's the other thing that makes it complicated in these situations, is that when veterans in need have caregivers, it's like they have the kind of caregiver that goes over the house and does more of the physical labor of caregiving. And then they'll have maybe another child or a relative, and they handle all the books, they handle the taxes, they handle the finances, the insurance, things like that. Make sure you're on the same page when you talk to the enrollment specialist, either on the phone or in person. Now, catastrophic. What does catastrophic mean? A catastrophic health determination kind of overcomes the service and the income that we talked about above. It's reserved for veterans who have a quote, severely disabling injury, disorder, or disease that permanently compromises their ability to carry out the activities of daily living. So if your relatives, your parents, or if your spouse is in that kind of a situation and you're applying for the VA healthcare, you need to make that clear about how their activities for daily living, which we're going to cover in a little bit, how that's going, because a catastrophic determination is kind of like a catch-all. But if the situation warrants, you need to ask for that kind of a determination. What the VHA will do after you enroll is they will schedule you for an initial exam with a primary care provider. Now, what does enrolling in VHA healthcare get you? Well, first off, it gets you the best healthcare around, and it gets you transportation because we have a free veteran shuttle. But it also gets you into other programs. If you know what that song is, please put it in the comments below. Let's talk about two key VHA programs. The first one has to do with home-based primary care. This is where aides will assist a veteran with their activities for daily living. It is not around-the-clock coverage. And here's a hint, there is no VA around-the-clock coverage for those who age at home. But it will help the family out with some of the burden of the caretaking for ADLs. That's the first one, home-based primary care. How do you get it? You have to be enrolled in VA healthcare. You tell your situation to the primary care physician. They will refer you to a social worker. Every person enrolled in VHA healthcare has a social worker, and then you tell the social worker, I'd like a referral for home-based primary care, and they'll make an evaluation. So that's the first one. The second one is caregiver support. This is, in my opinion, the newest and the best VHA provided program. See my video from October 2021 for specific details. The one where someone throws a pack of adult diapers at my head. You may want to watch that video just for that. But this program gives you access to a support group, a social worker, another social worker, and if you're eligible and if the veteran is eligible and you take the training to be a caregiver from the VA, it's online training, they may pay you to be a caregiver, and then you spend that money maybe on hiring an aide to help you out in addition to that. Remember, specific eligibility still apply. Can you get home-based primary care and caregiver support? Yes, you can. So those are the VHA programs, which are Veterans Health Care, caregiver support, and the third one is home-based primary care. Again, specific eligibilities apply for all of those. The other part of the VA, the Veterans Benefits Administration. This is where you get service-connected disability pension benefits or pensions. That's another part of the VA. And the program that everyone calls about between, this time of year, between December to March, is they call about aid and attendance, which gives the impression that the veteran will be attended as needed, like around the clock. But it doesn't work that way. There are limitations to it, big limitations. Also, aid and attendance is one of 3 parts of a specific program. And to help you along, I know I'm passing a lot of information, there's going to be words on the screen to help you with it. Aid and attendance is part of the improved pension program. The first part of and I'll just list all 3 parts now. Non-service connected pension is the first part. Housebound is the second part. And aid and attendance is the third part. Now, to be eligible for the improved pension, you have to serve during wartime. I'll make that clear right off the bat. Could just be one day during wartime, but you have to serve during wartime. The non-service connected pension is for those usually who are over 60, collecting Social Security and have a condition that prevents them from working, which could just be advanced age. This condition that they have does not have to be service connected from service. They just have to have it. The maximum allowable pension rate for 2023 at the time of this filming is $1,386 for non-service connected pension. Well, wait a minute, Dennis, you just slipped in a term, maximum allowable pension rate. I did. And what is that? And I'm going to warn you right now that we're going to do a little bit of math. It's just going to be addition, but we're going to do a little bit of math. And maximum allowable pension rate is the maximum money you will get considering the income and the costs that you already have. So for the non-service connected part of improved pension, it acts as sort of a Social Security retirement top-up. It's the only Social Security retirement increase program that I know of, and it exists because the VA acknowledges that wartime vets may have periods of unemployment, preventing them from having a lot of Social Security retirement credits in their lifetime. The math we're going to do now is for veterans with no dependents. Those rates are always going to vary, and you always have to talk to a VSO about it. So a veteran with wartime service, let's say, collects $1,000 a month for Social Security retirement and can't work due to a disability. In this case, it's just going to be advanced age. If we take a maximum allowable pension rate of $1,336 and we minus $1,000 for their SSR, which they're already getting, their award for a non-service connected pension would be $336 a month. Well, that was easy. Yes, it was easy, but it's going to get a little bit harder because I'm going to talk about the other program. The difference between non-service connected pension and housebound aid and attendance have to do with physical and mental conditions and how they relate for activities for daily living, such as bathing, cooking, maintaining hygiene, dressing, toileting, eating and walking, and watching TV. I'm just kidding about the last part. That's not an ADL. If they only have a few ADLs that they need help with, they would be in the housebound category. This doesn't mean that they can't leave the house and they're trapped. It's just a term. If you have a whole bunch of ADLs or just one sickness such as dementia, you would fall in the aid and attendance category. So a couple of examples of MAPR calculations for housebound and aid and attendance. I'll go through it relatively quick because you're going to have to see a veteran service officer anyway. MAPR for housebound is $1,633 a month. MAPR for aid and attendance is $2,229 a month. These are rates right now for veterans without dependents. Housebound example. Housebound income of $3,000 a month minus $2,000 in qualified medical expenses. So you're able to adjust your monthly household income with out-of-pocket medical expenses. So that $3,000 minus $2,000 minus $2,000 in qualified medical expenses gives you $1,000 left over. The maximum allowable pension rate of $1,633 means that the award in this case would be $633. I'm going to use the same thing for aid and attendance. Household income of $3,000 minus $2,000 in unqualified medical expenses means $1,000 left over. The maximum allowable pension rate for aid and attendance is $2,229 at the time of this filming, and that means that you would get an award of $1,229 a month. So, just a mental break here because this is the longest video that we have. We process a lot of these claims, but toward the end, if you stay tuned, because I just hit you with a bunch of math, we're going to talk about a couple of alternative programs that we've been pushing lately. All right, what are qualified medical expenses? There's a whole list. Out-of-pocket medications, medical equipment maintenance. But the main one always seems to be nurse aid or caregiver costs. And aid and attendance and housebound are great programs because you get to adjust your income with medical expenses, but it's a little bit tricky in its flexibility. The caregiver costs that we mentioned above do not have to be a licensed nurse's aide or a person from an agency. It could be anyone that the veteran chooses, including a spouse living at home, doing it anyway, or a relative or a neighbor. It doesn't matter. How is that tricky? Well, this is how it's tricky. When you apply for housebound or aid and attendance, you need to have these qualified medical expenses as existing. That means that you have to create the expense for a caregiver based on activities for daily living. You have to show that money goes from the veteran's account to another account. Now, because that veteran caregiver is a relative, usually the spouse, and they've had the same checking account for 50 years, that's where it gets complicated. We just need someone to set up the caregiver to have another account. Money goes from the veteran's account to that other account. Does it sound like money laundering? Yes, it does sound like money laundering, but this is how it works. You need to create an expense and you need to show the transfer of funds. Talk to a VSO about it. I know it probably just blew your mind about it because it seems like cheating, but it's not. It's just the way that the program works. But if someone has a problem now and they're looking for housebound or aid and attendance, how long does it take? Well, unfortunately, it takes several months for the VABA programs. Several months for the program. That's outrageous. Yes, it is. And that's what a lot of times with our hair on fire. That's the challenge that we face for aid and attendance and housebound. Benefits from the VBA. Sometimes we get lucky and it's shorter, but a lot of times it takes a long time. The hardest part is getting all the paperwork together for these things because it's based on income. I like to tell people it's kind of like doing your taxes and having a root canal at the same time, because we need to show every bit of income and every qualified medical expense with a receipt. They're good programs. We're going to continue to do these programs, but I want to talk to you about a couple of alternatives that are not from the VA. Remember I said that we're a big part of Health and Human Services. Our sister program is the Office of Senior Services, and they have 3 programs for people to safely age at home. These programs are eligible only for those over 60, which is good because I'm going to be 60 soon. Just putting that out there. Caregiver support. Caregiver support is a simple one. It is a reimbursement program for medical supplies, usually incontinence products or other medical equipment or nutritional supplies like Ensure. It's based on household income. You could receive up to $600 a month. I don't run this program. The Office of Senior Services runs this program. They do a great job. I would give them a call about caregiver support. A little bit of money goes a long way. All right, the options program. The options program is designed to keep a person able to safely age at home with community services depending on their level of need. It is a cost-sharing program based on household income to pay for qualified medical expenses. So some income doesn't count, like VA benefits like aid and attendance or dependent indemnity compensation doesn't count as income. There's a whole list of stuff that counts. It doesn't count. You're going to have to go through them, and they're going to tell you. The program pays up to $786 a month of cost sharing, which works out with current rates to about 6 hours a week of care. And but the good part about the options program is it sometimes takes like 2 weeks to get approved. And that's an average. I'm not making promises. We don't run the program, but we're referring a lot of people to this program. You have to use a contracted agency for the caregivers, unlike the housebound and aid and attendance program with the VA. And depending on where you live in the county, I'll just give you an example. Zieglersville. Where's Zieglersville? Look it up. Certain areas are hard to find contractors that'll come out there. The money is not just for AIDS. It's also things such as Meals on Wheels and an emergency alert button. The Office of Senior Services does the assessment. They assign a care manager that oversees all services and care. The last program, and then we'll talk a little bit and we're done. Thank you for staying on this long. The waiver program. This program is also designed to keep a person able to age at home with community services, but it's based on clinical need. There are income limits and assets. If your gross income and assets are under the maximum, you could receive daily in-home care. This is the most robust program that we have out there. Now, the income limit is $2,742 a month. and assets cannot exceed $8,000. You got to spend down before you get this kind of assistance. This program gets approved in about 2 months' time, depending on claim complexity. Many times, like I said, we refer clients to the Office of Senior Services for the programs before we consider them for housebound and aid and attendance, because you could get more money and you could get it faster. As a general rule, you can get options and be on the improved pension, but it is difficult to get waiver and be on the improved pension, because once you get the improved pension, it may bounce you and you'll be over income. But if you want to get these the waiver program, you'll be assessed at first by the Office of Senior Services and also an independent enrollment broker who changes, but I'm not sure who it is now. I think it's Maximus, but that's just at the time of this filming. That may change later on. But they would look at the clinical part, they would do a home assessment, things like that. So this is a number. Call the Office of Senior Services at 610-278-3601 and ask for their enrollment specialist and tell them that Dennis Miller sent you. The last part's not going to mean anything, but I don't know, maybe it'll make you feel better. Back to Abraham Lincoln and the spouses and the children, because of what he said. Surviving spouses of wartime veterans are eligible for the improved pension and housebound and aid and attendance. But this means that they were married when the veteran died. Ex-wives are not surviving spouses. And surviving spouses, unfortunately, are not eligible for VHA programs. They are eligible for something called Champ VA, which would be a whole other episode. Ask your VSO. Children of veterans who were declared developmentally or physically disabled before the age of 18 are eligible for the improved pension. But they're not eligible for VHA programs. And my last disclaimer here is that everything that I just told you today has an exception, but those exceptions are extremely rare. You need to ask your VSO. Now, normally during these videos I talk about upcoming events. I'm not going to talk about that. You just follow on our social media and you'll see the upcoming events. You know how we triage our calls based on severity. I'm just going to try to keep it short. So I'm not going to do the regular closing. Thank you to all of our partners out there to help us do what we do. Thank you for sitting for this. You probably have a whole bunch of questions. Hopefully you wrote them down, and then you could meet with a VSO. Call 610-213-4022 or email us at teamveterans@montcopa.org. Thank you very much. We'll have another monthly video update in May. It'll be shorter and it'll be fun. And start thinking about Memorial Day, putting out flags. 'Tis the season. Thank you.